Injurynet's initial care program is really easy. As soon as an employee is injured or ill at work, they call our nurse triage hotline. Our nurses are available 24/7. They will talk to the person to find out what's happened at work, how have they got ill, what's their medical history. They'll go through a series of questions to work out what's the best way of managing this person's injury or illness. Should they or can they look after their injury themselves and self-manage with some simple first aid and advice? Do they need to go and see a doctor or a physiotherapist or a psychologist to manage their injury or illness? Or do they actually need to access an emergency service? If you need to have an appointment, our nurses will transfer your call to our initial care team, who will organise an appointment with one of our network doctors, physiotherapists or psychologists around Australia. We have over 6,500 practitioners around Australia across 2,900 locations. We focus on getting appointments on the same day or the next day as your call, so that you know that you'll get access to early, prompt treatment. Our network practitioners specialise in managing workplace injuries and illnesses, and will have a focus on communicating with you and your employer, and they will also focus on helping you to recover as quickly as you can, and making sure that if you can recover at work, that you do, or otherwise that you return to work as quickly and as easily as possible. The program benefits both employees and employers. For employees, it's about being able to call someone straight away as soon as you're injured and have some guidance about what the best thing to do is to manage your injury. So whether you can access a doctor or a physiotherapist or a psychologist, whether you can manage it yourself or whether you go to emergency. So it's really reassuring to have that conversation with the nurse to know what to do next. The other benefit for employees is really around having access to a network of practitioners that's interested in workplace injuries and illnesses, and that's really going to work with you on helping you to recover at work and return to work as quickly and as safely as you can. For employers, it's about making sure that employees are looked after, that they're accessing the right treatment at the right time. And it's really also about making sure that they're accessing practitioners that are going to work with them, communicate with them, and help them to make sure that they've got the right supports in place to help a person to stay at work or to come back to work.